Well, hello and welcome to Raj Sabha TV. You're watching India Fights Back with the host Rajat Kane. Well, this is a show where we get you the latest and all the important development in India's fight against the COVID-19 pandemic. In this edition of the show, we'll discuss how India is preparing for a massive vaccination program. The government has said massive production of COVID-19 vaccine will start once scientists give the green signal. All the preparations have been made and an outline has been drawn to ramp up production of vaccine and to make it available to each and every person in the shortest possible time, the one who requires it. The Serum Institute of India and Bharat Biotech have applied for emergency use approval. The Prime Minister too has interacted with all vaccine manufacturers and scientists. Currently, there are 6 vaccine candidates in clinical trial stage in India, and as per the government, some of the vaccine candidates may get licensed in next few weeks' time. Well, to discuss this extremely important issue, we are joined with a panelist of 3 important guests. Dr. Suman Kanungo, he is scientist from ICMR, National Institute of Cholera and Enteric Disease. Urvashi Prasad, she is public policy specialist from Niti Aayog, and Dr. Sanjay Rai, professor of community medicine from AIIMS. Well, many thanks for joining us. Let me start with you, Mr. Kanungo. Given the size and scale of the country, let's begin with the challenges of rolling out the vaccine once we are ready. How much time it will take to get to each and every person who requires it?
Yeah, thank you for the very important question that we can. As you know, the government of India has already declared to implement the vaccine program in a phase-wise manner. First, to start with the healthcare workers, then with the frontline workers, then with the elderly population with comorbidity, 50 years and above. So, if considering the massive population size, if you consider it's 1 crore healthcare workers, which includes doctors, paramedics, and around 2 to 3 crores for each of frontline workers. That includes police, home guards, civic volunteers, and around 27 crores of population with comorbidity. So it's around 30 crores, and these vaccines are basically two dose vaccination with a gap of around 4 weeks. Then 60 crore doses are required. So India is gearing up through development of say modules, technical platforms, facilitating the cold chains and motivating the state at the block level, at the state level, and from the chief secretary down to the block development officers, all are getting involved. Line listing have been done. So India is gearing up for this massive vaccination campaign. So, considering considering the massive size, now, as you rightly said, these vaccines are in pipeline, and Serum Institute, Bharat Biotech, they are in the phase 3. Some are coming in the phase 1 and phase 2. Some are in preclinical. So, we are all gearing up to see the efficacy and safety of these all important. Some are whole virion inactivated vaccines. Some are subunit vaccines. Some are adenovirus vaccines.
Right.
So these. So once the vaccination recruitment across India are going on, once this is done and follow-up will start. So these are basically all event-driven studies. Once we get the events, we can be able to tell you surely how much effective it is and how safe these vaccines are. So we are gearing it up. In near future, we'll be able to measure this.
Right. Dr. Suman Kanungo, I'll come back to you. Thanks for your opening remarks. Dr. Sanjay Rai, let me ask you one very important question here. As I asked Dr. Kanungo as well, given the size and scale of our population, now, will it be one of the largest immunization exercise that we'll take in recent times?
See, we had in past also we had this type of exercise. Like one example was pulse polio. So for pulse polio, almost for entire population less than 5 years of age, children less than 5 years of age, almost that if you convert into the number, 25 into 5 million. So that is 125 million children. So in each round, we vaccinate almost 125 million children, less than under 5. But definitely, this would be the greater number would be definitely greater than that number. Like Dr. Kanungo mentioned that around 2-3 crores or so 30 million would be only healthcare provider and then frontline workers, etc. So this would be the largest this vaccination drive, no doubt. There is no doubt. But already that's why this type of preparation, even the Prime Minister taking the proactive role. Already he has taken several meetings of various stakeholders, including chief ministers and other states functionaries. So definitely we are in the right direction, and I can say that we will be able to manage this.
Right. Dr. Rai, just one more question before I go on to the next panelist. She's been waiting here, Ms. Urvashi. Let me ask you this question here. You cited example of the pulse polio vaccination or the immunization program. There is, you'll understand, there is a difference between the pulse polio immunization program and the COVID, which is a pandemic stage. So will that add to the sense of urgency as well? I mean, if I may put it in extremely oversimplified terms, is it like, are we racing against time, although the numbers have shown a consistent flattening of the curve?
See, the first is the technical part. Like, definitely there is a difference between pulse polio and this. Pulse polio is the oral drop, right? So you require some person. Here, we have to inoculate this, and that is 2 doses at an interval of 4 weeks. Minimum 2 doses at the interval of 4 weeks. So for that, you require a skilled personnel, like either nurse or some technician. So like ASA or any other health function, they can't give this vaccine. Whereas pulse polio can be given to by anybody. So this is a huge difference between. I was talking about the total numbers. That even in the pulse polio, we are covering a huge number, and this country that was the largest drive for any vaccination coverage in within 2-3 days time. After this pulse polio, I can say definitely this is the largest drive covering a huge number of population, 30 to 40 crore population in a phased manner. So definitely that will be a very big challenge for everybody, including healthcare provider, administrator, all those who are involved in this containment of COVID-19 pandemic. So definitely it's a great challenge for us.
Can I chip into Dr. Rai?
Absolutely, sir. Okay, sure, sir. Sure. So please go on.
So let me give some numbers. Let me give some numbers so you can understand what is the magnitude. Around 86,000 cold chain units are required to maintain this cold chain. This is basically at 2 to 8 degrees centigrade. This whole virion and the subunit vaccines, as well as this adenovirus vaccine. So it requires 86,000 cold chains, and we have 2.34 lakhs A&M workers who are running the biggest EPI extended program on immunization in India. Apart from that, 1.5 lakh ANMs have already been identified who will be engaged for this vaccination campaign. So government has already prioritized the list. They have formed a digital platform. They're involved the state functionaries from chief secretaries out to the video levels. All the cold chain units have started has identified functioning, and all the ANMs, the auxiliary nurse, as Dr. Rai said, that it has to be inoculated, injectable. These are all injectable vaccines. So these are this is a huge thing, and the government has readily responded with identification of all this.
Let me go off to Urvashi Prasad here, who's been waiting here for quite some time. Thanks, Urvashi, from Niti Aayog for joining us. Urvashi, this exercise, given the scale, size, and of course the challenges, is not just confined to just health sector. Which all sectors of India, in terms of apparatus, do you see would be a part of this whole exercise to talk of? I'm sure there'll be the science and technology, IT as well.
Yes, so I think, since you mentioned technology, that's going to be a very important part of the whole effort. The government has already launched or is developing the CoWIN application,
Yes,
which
absolutely.
many of your viewers would have heard of, which will really, allow multiple purposes to be served. One is that it will allow real-time monitoring and tracking of the cold storage facilities, who is being administered the vaccines, and then ultimately for beneficiaries to get their the vaccination certificate. So I think technology for any exercise which is at this scale will obviously play a very big role. But we will also have various other ministries and departments like the Panchayati Raj, for instance,
Okay.
because we'll have to really involve the local communities. Remember, this is a new disease, it's going to be a new vaccine. There might be certain adverse effects which are a bit unusual or which
Okay.
people might not have seen or been familiar with before. So we'll have to mobilize the communities, engage with people, so that any sort of myths and misconceptions and fears that might exist can also be addressed. And then we will also need to use, ministries like transport, railways, defense, right? I mean, all these ministries, if you look at the mission Indradhanush, they actually played a big role even in that. So similarly, in the COVID vaccination efforts, we will see mobilization of a large number of stakeholders within the government, but also outside the government. We need to engage with private sector. We need to engage with local communities. Only then will we be able to execute an exercise at the kind of scale that we require.
Is the government also, or let me ask, I mean, just an off question here. In such an exercise, is it also required to communicate to the stakeholders in a wide, expansive way, as you yourself said, that it's a new thing and possibly there may be some adverse effect, which is why you need to include or take into confidence the local communities?
Yeah, so of course, at the government's end, we will need to have a robust monitoring system to track any adverse side events that might happen. These are, of course, a part of routine immunization efforts also. In fact, in technical terms, it is called pharmacovigilance, where, once the vaccine goes out into the population, you do monitor, any side effects and adverse events, because naturally the population is a different setting from a very controlled trial setting. So that is something that, of course, we will need to do. But we'll also need to engage and inform communities because very quickly, fear can spread or some myths can spread, some misconceptions can spread, and we don't want that. So we'll have to involve the local community influencers, the religious leaders, the local
Right,
leaders. That's
right.
where I said Panchayati Raj will come in because you'll have to involve your village leaders, your sarpanches, your panchayats, all of them to really sort of create awareness and also address any fears and myths and misconceptions that often surround vaccines.
Right, right. Well, Dr. Suman Kanungo, you were citing certain graphics and they were fairly elaborate numbers. Just one simple question here. In this exercise, it's not just about the beneficiary, but as you mentioned, you'll be also training the medical staff, the supervisory staff who will be vaccinating the beneficiaries. Is it so? You'll be having an extensive training program for them, as this vaccination happens to be different from the previous ones. Is it so?
Yeah, absolutely. See, this is basically an injectable vaccine. So, regarding the injections and all that, maintaining the cold chain, it is as good. I mean, it is going on basically for the other immunization programs. But as she's rightly said, the involvement not only involving the beneficiaries about the the communication. You have to have an excellent communication system. Not only the administrators as well as the vaccinators, they need to understand the common side effects and all that. But this regarding the training per se for maintaining the cold chain or giving the vaccination inoculation, that requires training, but that is not something extraordinary. It is already going on with the other vaccination programs. So it's not the preparedness not only includes the identification, mobilization of the vaccinators or the other logistics, but at the same time acceptance and post vaccination effects that need to be taken care of, and the government is moving towards that. They have already planned it like that.
Right, right. Urvashi, generally in these exercises, given the history of immunization in a country like ours, and of course, like there are countries which are lesser in population, would there be pressure on us? You mean the government, you mean the health workers and other ancillary staff, given the population, and also at the same time as there is a panic factor, even though the numbers happens to be flattening to say off if we talk of the last few weeks.
Yeah, I think the panic factor has, thankfully gone
Gone down
down. And
considerably.
in some cases, we are now actually having to grapple with the other side, which is a bit of complacency or a bit of fatigue, COVID fatigue. So we are actually kind of now seeing the other side a little bit as well. But it's good that the panic has gone. That is, of course, in a very, very important that, because panic is obviously it's not a useful reaction, but it's a very natural one to a pandemic situation. But I think, with the vaccine, we'll also have to keep communicating that just because you have got a vaccine does not mean that you can let go immediately of all the other precautions. I think that's the other communication that we will have to keep up. Because getting a vaccine is not sort of a holy grail. You still need to follow, at least for the foreseeable future, some of these other precautions of at least wearing face masks and maintaining your hand hygiene, etc. still need to be followed. So
Even
I
after
think we'll need
vaccination,
to.
you mean to say? Even after
Yes, so I
vaccination,
think
we'll
we'll
keep on.
need.
Okay.
Yes. So we'll need to keep that communication, I think, very clear, because unfortunately, otherwise, some people might feel that okay, we've got a vaccine and it's kind of like our passport to do whatever we want. So I think that we'll have to be very clear that that is not the case, and you'll still need to be careful. But of course, a vaccine will play a huge role in eventually bringing us to a status where we can get this whole situation under control.
Dr. Suman, are we looking, therefore, as Urvashi mentioned, that even after having a vaccination, we need to still follow these basic guidelines, or to say the behavioral guidelines of wearing a face mask, maintaining social distance, washing our hands, and of course, like just maintaining hygiene around us? So are we moving towards a very new sort of a scenario post this COVID pandemic is over? Even after this is over, I mean, there will be a certain behavioral changes aspect in the society to say off.
Absolutely, it's 100%. See, first of all, before I go into that, let me remind you, none of the vaccines that have been discovered throughout this till date is 100% protective. So the importance of hand hygiene, the social distancing, as well as the mask, this will remain. This will remain, and this will remain. This will stay,
Okay.
and
Okay.
we need to take that into our daily lifestyle and daily behavior. We are entering into a post-COVID new era where whoever gets vaccinated or not, this will have to stay. Otherwise, I mean, then a thing will come when we'll say, there's a vaccine failure. It's not that. That is the mainstay of prevention. Primary prevention includes that as well as vaccination. So vaccination has got added advantage of herd protection or indirect protection, which can provide to those who are not vaccinated. That is also a gain. But at the same time, I must reiterate that mask, social distancing, and hand sanitizing is the mainstay of fighting this disease.
Sir, as we come to the close of the show, let me just ask you one simple question here. I mean, given the numbers, given our recovery rate percentage being on the higher side, and the fatalities, unfortunately, there have been casualties due to COVID, which is more than 1 lakh. But comparing with other countries which have a more robust health infrastructure, you think we have done well to say off in that regard?
Absolutely, absolutely. We have done very well compared to the some of the developed countries where to curb down the death, especially the case fatalities, as well as the containing the cases within certain geography. If you look at the graphs carefully, it is contained within certain areas. We have till date there is no place for complacency, but still we have done good, I should say.
Urvashi, just as we close the show, you also agree that we have done good, given like when the pandemic hit us, there were a lot of concern about India's healthcare sector, our logistic challenges. So given that we have done fairly well if we compare our numbers with other countries, or to say the developed countries, what would you attribute that to?
Yes, I mean, of course, because we do have a very large, very diverse population. Also, you have to remember that some of these, public health and hygiene behaviors have not been as inculcated in us culturally as in certain other nations. In some other nations, mask wearing in public places is very common, for instance. But in India, it's not really been the case that, we usually wear masks, in public transport or in public places. Plus, we have a very, diverse health infrastructure per se. There's a lot of interstate disparities. Some states are at a much better position compared to others. So given all this context, I think we have definitely managed to do a very good job. And considering that COVID has overwhelmed some of the most developed health systems also, as you said, even if we look at countries like Sweden or UK or, several other countries which have very advanced health systems and high levels of spending on health, even they have been overwhelmed. So I think we've done very well. Obviously, there are lessons from this for us for the future and what we can do better and how we can focus more on public and preventive health. So hopefully we will take those lessons and we will institutionalize those. But for now, yes, there is a reason to be, fairly satisfied with how we've managed to perform. But of course, it's still a long road ahead, and we should not be complacent. We should keep up our efforts from the government side as well as from the side of citizens.
Absolutely.
Well, on this note, we'll sign off. Thanks, Urvashi Prasad. Thanks, Dr. Suman Kanungo. It's still work in progress, long road ahead, and we have to be careful, not complacent at all. Remember, vaccine may not be the end of it. We still need to follow basic things. Things like, which is also our appeal to our viewers, well, small things that is required to defeat coronavirus pandemic. Wear face masks. Keep washing your hands 20 seconds at least. That's what the expert says. And lastly, maintain or follow physical distancing. These are the only small things that you can do by yourself to defeat the coronavirus pandemic. Well, thanks for watching this edition of COVID-19 India Fights Back. Keep watching Rajya Sabha TV for more such programs. Thank you.